Hello, my name is Bruce Wang. I'm one of the infectious disease doctors here at RUHS. So I was asked today to talk a bit about our diagnostic capabilities in the COVID pandemic at this point. Currently, we have three machines in-house that can perform COVID testing, and they're being validated: the BioFire, the Abbott, and the Cepheid at this point. They're all PCR-based machines, and they all have pretty rapid turnarounds. The differentiation between these tests are how sensitive the tests are, and along with the other capabilities of these tests. I think a lot of people have heard about the Abbott Realidie test out in the community at this point. It's a very rapid turnaround test. Positive results can come back in as quick as 5 minutes, whereas negative results can come back in about 15 minutes. It's a very nice quick screening test. The caveat with this particular test, of course, is that it's not the most sensitive test. So there's a chance that it can also miss positives, and it has what we call a very high limit of detection, meaning you have to actually have a significant amount of viral load. Otherwise, it does have a lot of what we call false negative testing. So for a very quick test that you may want to do a quick screen for, it's a pretty decent test, but it probably isn't the first test you would want to reach for if you have other options. The other two tests that we currently have in-house and being validated is the BioFire and the Cepheid. Both of these are PCR machines. The actual runtime on each of these is about 45 minutes once you load the cartridge in the machines. The nice thing about these is there are multiple modules, so you can run multiple tests at a time. They're very quick and efficient, and they're very sensitive and specific. So if the sampling is done appropriately, you often can get pretty good, reliable tests. And again, you don't have to send these out to an external lab, so that's very nice too. The nice thing too about these two machines is they actually have a lot of other capabilities. You know, here at RUHS, we're not just focusing on just COVID. We have to really look at the long-term care of our patients. You know, what's going to be happening next season? What's happening in the community? The Cepheid was originally brought in to help with our OB population because it can do what we call rapid group B testing to help minimize pregnancy complications, and that can be done in-house. As we know from public health before all of the COVID pandemic, there's a significant outbreak and essentially could even call it a pandemic of sexually transmitted diseases. And the Cepheid actually can run gonorrhea and chlamydia testing in-house very rapidly. So if you're coming into the clinics, into the emergency departments, this can be run pretty quickly, and the doctors can and nurses can try to get an answer quickly to treat patients coming in for this. So this would help both on the inpatient ED clinics and in the community overall. The BioFire is actually a very interesting machine. On top of potentially being able to test for COVID, it's going to run on panels. So for example, especially during the winter time, when you think about flu or other viral infections, the panel can also test for other viral infections. So let's say you come in and you don't have COVID infection or flu, it may find another viral infection to help detect and explain to you why you have those symptoms. In addition to that, it can test for stool infections, blood infections, and then also what we call CSF or spinal infections, which are notoriously difficult to diagnose because a lot of these tests are send outs. So those are really great capabilities, not just for currently now with COVID, but looking long term for RUHS. In the process of this, RUHS is also expanding mass testing for COVID as well. And what we're trying to do is create a real-time PCR system in our facility so we can run massive amounts of tests at once. What this would likely provide is being able to help potentially open up more time-sensitive procedures such as surgeries and other surgical-based procedures so that more patients can be tested, and this will hopefully allow and reaffirm the community that we're doing everything we can to try to ensure the safety and health not only of our patients coming in here, but the physicians and the employees as well. There's a lot of different uses for all these tests. The workhorse test, again, is these PCR-based testing, and what we're going to be utilizing those for is to provide quicker turnaround times and answers for patients, physicians, nurses, all our healthcare providers coming in, so that we can provide the safest and most comprehensive hospital-based environment here for everybody coming in here.